Good afternoon. We are visiting today with Dr. Carrie Doyle, Director of Clinical Practice, Research, and Staff Development at Providence, Alaska Medical Center. Thank you for joining us, Dr. Doyle.
Oh, you're welcome.
Today we're going to be talking about the benefits of nurses becoming certified in their specialty areas, and we appreciate your opinions on why this is so important. Just have a few interview questions for you today.
All right.
So first of all, in your opinion, what are at least 3 benefits of nurses becoming certified in their specialty areas?
So there are a number of benefits that a person does get when they become certified. I'll talk about a few of them here. The first one is verification of expert knowledge that a person gains when they become certified. It really is a recognition of the professional achievement that they have gained in their specialty. Second one would be it assures the consumer that that individual who is caring for them has achieved a certain standard within that specialty. And these are individuals who have the best knowledge, the highest standards to care for them. The American Board of Nursing Specialties states that public recognition of certified nurses is the way to tell the consumer that individual has reached a special status. The last one is one that is for most nurses they like, oftentimes can lead to career advancement and to higher pay in some cases depending on the institution. So all of those are benefits. There are a number of benefits when you look at the literature and the research as far as better patient outcomes, better staff satisfaction, better retention when a person is certified.
Okay, thank you very much. So it seems like you have vast experience. So what are 3 strategies you could share with nurses to better prepare them for taking these exams? I know you've sat for some yourself.
Yeah, I have 2 current certifications. One is an adult clinical nurse specialist in adult health, and then also as a certified emergency nurse. So the first thing, you really cannot overemphasize ego integrity when it comes to taking a certification exam. These can be very stressful to the individual. And so the first biggest step really is to get the individual to apply. And so sometimes it's getting out those applications with the staff, walking them through the process. That really is a big first step, is to just get it applied for and get it scheduled. The next thing is for the individual to find a study partner. Sometimes it helps to work with another individual who is also studying for the exam. You help to create a cohort sometimes, so sometimes big individual classes help. The other thing that you can do is attend a review course. And so there are a number of review courses out there. You can either create one within your facility, or there are a lot of canned courses that different organizations recommend that a person can do to prepare to take a certification exam.
Okay. So since you've had experience with this, what do you find that can maybe be a benefit that has impacted not only your own professional practice, but maybe nurses considering sitting for a certification?
So benefits, I'll start with one of the reasons that we really embarked on this journey at our facility, looking at the future when we know that there is a nursing shortage looming, especially with our baby boomers aging out, is that we wanted to retain our nurses that come to our facility. Now the literature will show that the more certified nurses you have on staff, the better your retention will be. And so that is one of the reasons that we embarked upon it in our facility. You do find that nurses have a higher satisfaction. They feel more empowered in their profession, which directly impacts practice and helping to determine what are the best standards to care for our patients. And so having a certification really helps to solidify that knowledge base that they have. The other thing is that you really talk about practice, your certification does need to be focused on your specialty. So you gain that higher level of knowledge, you solidify that knowledge base in the specialty that you're practicing in at the current moment. It can change over time as you move into different specialties. It's one of the glorious things about nursing. But as you gain that specialty knowledge, then it prepares you to become certified in that specialty.
Okay. So we know as nurses, physicians aren't necessarily paid more for being board certified, but they do it as an example of their knowledge and the ability to show excellence in the care they provide. So in facilities, whether it be this one or any other, where maybe no monetary incentive is given or maybe not very much, what do you find motivates nurses to obtain their certification?
One of the things I've noticed over the years in working on this in our facility is that there are a number of things aside from monetary incentives that do engage nurses into taking their certification exam. Public recognition is huge. And so one of the things that we do at our facility is we have a big tree, if you will. It's a bronze cast tree, and every leaf on the tree has the name of the nurse and their certification. And that is put in a very public area so that the public can recognize that we have these specialty certified nurses. One of the things I've noticed in this is that our nurses oftentimes will be more concerned about getting their leaf on the tree than they are with getting the pay raise. And we do both. We do monetary incentives and the public recognition. But oftentimes the public recognition goes a lot further. The other thing for motivating nurses to obtain them, oftentimes it can be an internal, intrinsic motivation, just that they have achieved a special thing in their career, and so that oftentimes can be a very big motivator for them.
Okay, thank you for that. So along those lines then, kind of building those nurses up and having them proud of their profession and what they've accomplished, how can we go further to get them to see this as a personal professional obligation versus just an option? And how do you think nursing leadership and administration can contribute to this viewpoint?
I think first and foremost, nursing leadership has to role model this behavior. One of my expectations for our managers, assistant clinical managers, directors, anybody in a leadership role is that they gain certification within their area of specialty as well. It's really hard to ask the staff to put themselves out to get a specialty certification when the leader has not done so as well. So I think that would be, and as far as engaging them in their professional obligation, part of it is really getting back to the tenets of what makes a professional, and not doing it for necessarily monetary gain, but really as part of that. This is what I do as a professional. This is how I show my expert knowledge in my chosen career.
Okay. So just final question here. Aside from tuition reimbursement, which I know this particular facility does participate in, what other support programs have you seen at other places or even thought about developing here to help nurses seeking certification?
So tuition reimbursement is big. We talk about paying for certification fees and recertification fees because they can be costly to the individual staff members. Helping for education, particularly with continuing education. Many certifications require a certain amount of continuing education per that specialty. The CEN, for the Certified Emergency Nurse, an example, requires 100 hours of continuing education over 4 years, and that's quite a bit. And so facilities can really help by putting in programs in place to offer that continuing education. The other thing that they can do is to help develop, help sponsor doing study groups, getting materials for individuals, and really motivating them, cheering them on in order to get their certifications. Because it's not an easy thing. It can be very scary for the individual to put themselves out there to take a certification exam. So really cheering them on and being supportive is a huge thing.
Okay. Well, thank you for your thoughts on this, Dr. Doyle, and for being a fine leadership example for nurses. We thank you for your time today.
Oh, you're welcome.